United States, around 280,000 women and 2,700 men hear those life-altering words, "You have breast cancer." That's about one diagnosis every 2 minutes. But here's something crucial to remember. Breast cancer is not a death sentence. Thanks to advancing medical science and earlier detection, survival rates have increased dramatically. Imagine waking up one morning, looking in the mirror, and realizing something feels different. A tiny lump, barely noticeable. Would you ignore it, or would you get it checked? Breast cancer. 2 words that can change a life in an instant. But how much do we really know about it? And more importantly, what can we do? Today, let's break it down simple, real, and straight. To the point. Understanding breast cancer. Breast cancer happens when cells in the breast grow uncontrollably. These cells form a lump or tumor, which can be either benign, non-cancerous, or malignant, cancerous. If left untreated, cancerous cells can spread to other parts of the body.
Breast cancer is not just one disease. There are different types, including ductal carcinoma, which starts in the milk ducts, and lobular carcinoma, which begins in the milk-producing glands. Knowing the type helps doctors decide on the best treatment.
Understanding the risks and symptoms. So, who is at risk? The truth is, breast cancer can affect anyone, but certain factors make it more likely. Age. Most cases occur in women over 50. Genetics. Mutations in BRCA1 and BRCA2 genes. Lifestyle. Smoking, alcohol, obesity, lack of exercise. But before you panic, let's focus on what you can control. Symptoms. However, there are warning signs everyone should know. A new lump or mass in the breast or armpit, changes in breast size or shape, skin dimpling or puckering, nipple changes or discharge, redness or flaky skin in the nipple area, breast, pain that doesn't go away. If you notice any of these, don't ignore them. A simple checkup could save your life. Many people fear going to the doctor, but the truth is, early detection makes all the difference. When caught early, breast cancer has a survival rate of nearly 99%. Ways to detect breast cancer self-exams. Monthly self-exams are another crucial tool. They're best done about a week after your period starts. Remember, you're not looking for cancer. You're getting to know your normal tissue patterns. This knowledge makes it easier to spot changes that deserve attention. Mammograms. Let's talk about screening. Mammograms are like having a conversation with your body. They can reveal issues before you can feel them. Digital mammography can detect tumors as small as a grain of rice. For most women, annual mammograms should start at age 40, but talk to your doctor about your personal risk factors. Treatment and hope. If diagnosed, what happens next? Treatment depends on the stage and type of cancer. Options include surgery removing the tumor or breast tissue. Surgery is a primary treatment for breast cancer that involves removing the tumor or the entire breast. There are 2 main types. Lumpectomy removes only the tumor and some surrounding tissue, and mastectomy removes the whole breast. In some cases, lymph nodes are also removed to check if cancer has spread. Radiation therapy. For breast cancer, radiation therapy is a common treatment for breast cancer that uses high-energy X-rays or particles to destroy cancer cells. Chemotherapy for breast cancer chemotherapy uses powerful drugs to kill cancer cells or stop them from growing. It is often used before surgery to shrink tumors or after surgery to destroy remaining cancer cells. Treatment is given in cycles through pills or IV infusions, usually over several months. Side effects may include nausea, hair loss, fatigue, and weakened immunity. Despite challenges, chemotherapy significantly improves survival rates and helps prevent cancer from spreading. Hormone therapy for breast cancer hormone therapy is used to treat breast cancers that are hormone receptor positive, meaning they grow due to estrogen or progesterone. It works by blocking hormones or lowering their levels to slow or stop cancer. Growth. Common treatments include tamoxifen, aromatase inhibitors, and ovarian suppression in premenopausal women. This therapy is often used after surgery to reduce the risk of recurrence, but can also be used for advanced cancer. Side effects may include hot flashes, bone thinning, and fatigue, but it significantly improves long-term survival rates. Treatment is tough, but support makes it easier. Friends, family, and survivor groups can provide strength. No one should go through this alone. Even if breast cancer hasn't affected you personally, you can still make a difference. Support research, spread awareness, donate, or simply remind the people in your life to get screened. Breast cancer is a battle, but knowledge is power. The more we know, the more lives we save. Share this video, spread awareness, and remember, early detection saves lives.